Good evening, and thank you for joining us here again on BlackDoctor.org. I am Ellis Dean, a senior project manager with BlackDoctor.org. I'm also director of digital programming and production. Um, if you haven't been watching us the past couple of Tuesdays, let me just give you a reminder. We are doing a series called Operation Life. And what Operation Life is, back to basics, as you can see scrolling across the bottom of your screen, is a series based on we're going to tackle those ailments, those illnesses that disproportionately affect Black Americans. And we're going to break them down as we're bringing in some top experts in those fields to really kind of help us navigate this, because we want you to have three things happen for you. One, we want you to be your own best health advocate. That is the best thing you can do. Number two, we want you to be knowledgeable and more adherent to any treatment plan that your doctor sets forth to you. And number three, we want you to have the best health and wellness you can have for the longest time of your life. And the only way you can do that is by being adherent and knowing more about your illnesses or about these illnesses, because as the saying goes, knowledge is power. So shout out to Agnes. I see you there, New York City in the house. I hope you're not getting too wet with all that rain being dumped from the tropical storm up there. But tonight we have a special treat. He is not unfamiliar to Black Doctor. You know him from Wellness Watch every Wednesday on BlackDoctor.org. But what you don't know is that he is one of the preeminent asthma and allergy specialists in the country. And so we couldn't have anybody else but Dr. Michael Lenore on with us to talk about asthma and COPD. Good evening, Dr. Lenore. How are you doing?
I'm fine, sir. And how are you today?
I am doing well, doing well. So we're going to just jump right in with both feet. All right. So many of us know that asthma, it affects the lungs. I've seen the kids with the pumps and the respirator, but really most people don't know. They just know it's just people can't breathe and they have to get a pump. What is asthma?
Well, asthma is defined as inflammatory disease of the lung. What that means is a bunch of cells move into the lung to protect you, and they do. But as a byproduct of that, so the airways close down and they started to produce mucus in plugs. And so consequently, it's different from other lung diseases in that you look at the lung like a tree. The tree has branches and it has leaves. Okay, asthma is the disease of the branches, not of the leaves. Pneumonia is the disease of the leaves. So when the airway closes down, the branches close down, then that causes a gradual increase in respiratory distress. And if it closes down 70%, then you can get wheezing. What is important for people to realize is that wheezing is a very late and dangerous sign of asthma. It is not an early sign. So you cannot wait until you start wheezing in order to start jumping into some kind of an action plan. So it's an inflammatory disease of the lung affecting the trunk of the tree and the branches, and it is reversible. Whereas people who have chronic obstructive lung disease, the branches are also involved, but for a number of reasons, their condition is not reversible.
Okay. So we're going to talk about COPD. So that is great to know. So it's a disease of the branches, and it's inflammation, and then that inflammation can continue on to cause obstruction in breathing in the branches, not the leaves. And right. The leaves are the areola. What are those called?
You, man, I'm telling you, it's good to talk with you because you the medical terminology. It's the parenchyma of the lung is what the branches are. And at the very tip of that parenchyma, something called the areoli, where the aeration takes place. Pneumonia is in the parenchyma. Other disease, sarcoidosis, lung cancer is in the parenchyma. But asthma is a disease of the branches.
Well, you just brought up a good point, because Antoinette said she always waits until she's wheezing. So we're gonna help you out tonight, Antoinette, and tell you what you need to be doing in terms of how to overcome your asthma. All right, so now we know what it is. So it's inflammation in the airways. Now I know there's different type, like there's childhood asthma, like early onset childhood asthma that some kids grow out of, and then there's this asthma that kind of persist throughout our lives. And so what are those differences, and why is it that some kids can get asthma early on and then just eventually grow out of it?
Well, there's several what we call phenotypes of asthma. That means it's the same disease, but has a different natural history. The one that we deal with most early in life is called reactive airway disease. It is a disease of infants and toddlers. And what happens is they get an infection, usually adenovirus or respiratory syncytial virus infection, and that forces the air, then the lung kind of jumps on that infection, brings in those cells, and as a byproduct of that, they start to wheeze. What's good about that, what's bad about it is they can be very sick, and can be very difficult. What's good about it is that they tend to be sick when they're sick, not sick when they're not sick, and then they tend to outgrow it by the time they're 3, 4, or 5. Then there's something called what we call the atopic march. These are children who start out with eczema as infants, and then gradually, because of the barrier barrier breaks in the skin that the eczema causes, they become sensitized to various things, foods first, and then environmental and other allergens. And then after they get the eczema, then they get the food allergy, then they get the nasal symptoms, and then they can grow into allergic asthma. So any child who has asthma after the age of 3 that is persistent and not related to infection usually has some form of an allergy problem, should have an allergy evaluation, but it is likely to carry that asthma on through till they're about 8 or 9.
Okay. So
then let me just go one step further.
Go ahead.
Then there are people who get asthma as adults. Sometimes it's very severe, intractable asthma. It's asthma comes all of a sudden. You say, well, why did you wake up one morning? You say, why am I wheezing? And then you go on to see that you're wheezing all the time. You're wheezing with exercise. You're wheezing at night, or you're coughing at night. And then subsequent to that, it becomes very difficult to manage. And when we talk about management, there are new things on the horizon that are taking care of some of that asthma. But asthma is not one disease. It's it's the same disease that presents in a variety of different fashions, each with its own characteristic.
Okay. So how does asthma get started? Is it hereditary? Is it environmental? Is it a combination of both? How do we end up with asthma?
About 60% of the people who have asthma have some hereditary component. Somebody in their family either has allergy or asthma or some other related problem. And so that genetics plays a big role. But I'm here to say to you, the environment plays a tremendous role, especially in those children who have the type, or adults who have the type of asthma that is associated with exposure to environmental triggers, like grasses, trees, weeds, house dust, mold, or animal dander, food, drugs, or insects. All those are triggers. And so that one of the things I always tell people, there is absolutely no reason for your child or you to be in the emergency room or in the hospital with all the things we can do for asthma. But it starts with understanding that it is genetic and understanding there's an environmental component kind of rolls in there, and that you are the best detective of those things that trigger your asthma. And you should really try to identify those yourself before you even go to the doctor.
So I hear you mention allergies, and we talked about eczema, which we know to be a skin condition, but there's some components that are connected to asthma as well. So how do allergies play that role in terms of like a food allergy, is environmental allergy, both that could cause the constriction of the airways and have some asthmatic type effect, or how does those two systems work together?
Well, there's one immunologic system. Most of the time when you're born with a certain immunologic system, and that system functions, but it doesn't change. There's one system in the body that does change, and that's called the TH system. We don't need to get into the detail of that. But what happens is if you are exposed to allergens early, or you're exposed to infection early, then the body moves away from developing allergy toward handling infection. If you are exposed late to certain allergens, then you develop allergy to them, so that system can be modified. Let's just take the case of peanut allergy, for instance.
Okay.
Lots of children have peanut allergy, and they have asthma associated with that. Well, what we know is that if you feed a child peanuts before he becomes allergic, as an infant, 3, 4, 5 months, then you can prevent the development of serious allergy to peanuts because you've changed that system. After 9 months or a year, you can't do that. And so consequently, what you feed a child early, to a certain extent, depends upon whether or not they'll have serious problems with allergy or serious problems with asthma.
Okay. Okay. So how much, and there's a question, there's been a couple of questions in the comments about how much does your diet play a role? Is it just about what you're the allergic, or is it something else that could be playing a role in terms of exacerbating or even generating an asthmatic type response?
Well, there are basically two types of reactions that people have to foods. One is an allergy and one is a sensitivity. So let's take lactose intolerance, for instance. Many of your audience have lactose intolerance. Can't drink milk, can't eat ice cream, still drink it, still eat ice cream. But in any event, that's not an allergy. Now, it does happen when you expose the person to milk. You do get a kind of a diarrhea and a bloating and all of that. But that has nothing to do with what allergy is. An allergy, you make something against something else. And so consequently, foods are, since you're in, especially as a toddler or an infant, foods can cause major problems because you make something against those foods. Common foods are nuts, wheat, egg, milk, and seafood. One of the saddest things, Mr. Dean, is when I get a patient who's about 35 or 40, he just made his favorite gumbo, and he took a couple bites, and he was in the emergency room with asthma or anaphylaxis, because there are times in your life when you can develop allergies to certain foods, but most of it's in children, and the foods, like I say, are egg, milk, nuts, seafood, and I'm forgetting one other, but eggs, milk, nuts, wheat, seafood, soy, those are the most common ones.
Okay. So yeah, I notice a lot of times, especially when kids go to school and they get that note sent home that says you can't bring peanut butter to the classroom because we've got somebody in the class that has a peanut allergy, and so therefore they want to reduce the amount of exposure that they have. And so, I mean, this is all interesting, but it seems like asthma is not like a broken leg where you can just put a cast on it. It's really got to be diagnosed, and there's different types that you talked about earlier in terms of asthma. So we've got to be really, really cognizant. So I'm sure that lends itself to how it's treated.
Well, there's no question. I mean, there's no doubt. But let's start with what you just said. Because it's so different, it's a very individual disease. And, you can do your own detective work. I'm just going to tell you, if you're in the emergency room all the time, you're in the hospital all the time, you're not doing your part, because there's so many things that you can do yourself. And the first thing is to identify those things that cause you to be symptomatic. I mean, everybody says, well, I just got exercise-induced asthma. Exercise-induced asthma is asthma that occurs after exercise is over. If you have asthma during exercise, you have poorly controlled asthma that's manifested by exercise. And so don't think you don't have asthma other times. You do. You may not be wheezing, but you're probably coughing, or you're probably short of breath. So I think that when you talk about the individual presentation, it is a very individual disease. It is not one thing in every person. And you need to know more about yourself and your triggers and the rest of it if you expect the medical system to give you the assistance that you need.
That's a very good point. And that's why we're doing these programs, so you can know more about the diseases and how it can manifest itself in public. We're here with Dr. Michael Honora. We're talking asthma and COPD tonight. So if you're just joining us, just welcome. If you have some questions, please put them in the comment section. There's been some great comments thus far, and keep them coming, and let us know where you're watching from. But you're absolutely right in terms of knowing what you are, what your allergies are, in terms of, we talked about the food allergies and how that could trigger. Sometimes we've got to talk about early onset. There's been some questions in terms of how can, and you touched on it a little earlier, but I want to remind folks, how can an adult like that might be 30 years old develop asthma later in life? Because it's generally considered to be an illness that develops in childhood and goes on. But if you didn't have it as a kid, now you're 30 years old and you're having asthma, how does that happen?
Well, it's just a different type of asthma. I mean, you may have had an infection that triggered these cells to come by and protect you in the lung. And then since they came, they decided to stay. And if they stay, they release chemicals. Those chemicals force the airway to close down, and that then causes the symptoms of asthma. What's interesting about that type of asthma, it's the most difficult to treat. A, because people don't want to accept the fact that they have it, which is
Okay.
always a problem when you have a chronic disease of any type. And secondly, because there's something about those cells that release those chemicals that make it far more intractable. And so if you've got it as an adult, don't feel like something is wrong. That's
Right.
a form of asthma that really needs as much care as when you were a child, or if you never had it.
Okay. So here's an interesting question. Great job. Great question. How can we protect our lungs?
Well, I think that the first thing to do is that it's hard to protect your lung against the disease that has a genetic component. And
Okay.
so consequently, you may be susceptible to those cells settling in your lung, releasing those chemicals, causing the problem. But certainly you can protect yourself, A, by understanding this, that poorly controlled asthma can ultimately lead, as an adult, into something indistinguishable from chronic obstructive lung disease. So
Okay.
if you're coughing all the time or wheezing all the time, and then are not managing it, then you're likely you can at some point in your life start to develop damage to the lung. That's the first thing. I think the second thing is to remember that asthma, that when you present with chronic coughing all the time, then that's a poorly controlled asthma. And a well-controlled asthmatic, really, patients with asthma, don't cough all the time, don't wheeze all the time. And if you think for 1 minute that treating yourself with albuterol as your only drug does anything to the progression of that disease, you are absolutely wrong. People who use albuterol, which is a rescue medication, by that I mean it does nothing to the cells, it does nothing to protect you. It opens up the airway regardless of what closes it. The people who use albuterol, they're in the emergency room more often, they die more often. And so consequently, if you're using albuterol as your main drug, a well-controlled patient with asthma will use 1 albuterol per year. I bet you got people on this call using 1 albuterol per week. And if you're doing that, you're not doing yourself any favor. You're saving yourself from, more progressive disease at the time, but it's a dynamic disease. But from a long-term perspective, if you're just using albuterol and you're using more than 1 canister per month, then you're not doing yourself any good in the long run.
But that leads us to our next question. What are some of we know about albuterol. That's the big one. That's the one that most people, if you went down the street and did a survey, you probably get about 7 out of 10 people that can name albuterol as a medication for controlling asthma. But you just said that is a rescue medication and not a daily medication. So if it's a rescue medication, what are the other medications that people should be using as a way to control asthma?
Well, let's go back to what causes it. It causes by trigger, so avoiding them is one piece. Not medicine, just as effective. But there are medicines that control those cells that I talked about. Mm-hmm. Surround those cells and prevent them from releasing those chemicals which force the airway to close. They're usually called inhaled corticosteroids. Sometimes they're in combination with albuterol-like drugs. But if you are on albuterol and you're not, and you are using it more than once a week or once every 2 weeks or once every month, and you're using it every week, 2 or 3 times, every month you get a new canister. If you're doing that without a maintenance medicine, like an inhaled corticosteroid, drugs like Flovent or Qvar, Asthma, you've heard the names, but they're usually inhaled corticosteroids. Now, when we start talking about steroids, people back away, and you should always be careful with the steroid. But the steroids we're talking about are inhaled corticosteroids. They're metabolized at the surface of the lung. They're not absorbed systemically, but they can certainly make a big difference, both in your control, your visits to the emergency room, and certainly your visits to the hospital.
Okay, so it seems like inhaled cortisol steroids are the ones that control those cells better than that will help relieve the asthmatic symptoms versus using albuterol, which is just a rescue, and that just opens up the airways.
Right.
Okay, got that. So what is the cause? There's a question. Somebody said they use Symbicort as their daily inhaler.
Right.
Okay.
Yeah, well, Symbicort is a combination of a long-acting beta agonist called formoterol and an inhaled corticosteroid. The new thinking about asthma is that it is almost a frontline drug. And not only that, not only can you use it as a maintenance medicine, you can also use it as a rescue medicine when you have breakthrough symptoms. So Symbicort is a very good drug. There are a number of drugs that we like to call long-acting beta agonists in steroid combinations. I'll name them because we're trying to give people some real information here. Dulera is another name. Advir is another name. Symbicort's another name. Those are all combination products which should be used more often by people who are not using albuterol on a more consistent and regular basis. The new thinking is a lot of people just jump to those to start therapy.
Okay. Yeah, because that was my next question. Like, why are people just so, dependent or adherent and just using albuterol as their kind of go-to versus using some of these other drugs, which seem to be better in terms of controlling asthma and asthma symptoms?
Well, Mr. Dean, I have several problems. I mean, I have pre-everything. I got pre-hypertension, pre-diabetes. I got some pre's I can't remember. I'm supposed to take 5 tablets every day, none of which is to treat a condition, but all of which is to prevent me from having something.
Right.
Man, I might miss Wednesday, I might forget on Friday. Anytime you have a chronic disease, it's very difficult to do something every day about it. I mean, It just happens to, and especially a disease like asthma, where sometimes you feel pretty good, even though the asthma is present. And so we used to call it poor compliance, but they wouldn't let us do that.
Right.
To change the name, change it to adherence.
Adherence, yes.
It's hard for people to adhere, to take medicine for a condition that they don't think is causing them problems in the moment. And asthma is that kind of problem. But if you think about it like this, every day you're not controlling it. It's eating away at your lining in your lung a little bit, making it a little firmer, scarring it up a little bit more. Then that way should motivate you to consider that, and especially with children. You really have to make certain that they're taking maintenance medicines instead of albuterol, not instead of albuterol, along with whatever albuterol they need for exacerbations or control.
Well, great. I mean, that really helps because thinking about it like that, because people think about asthma when they're having a crisis, right? I can't breathe, I need and that's when they grab for the albuterol, but then they might not be controlling it with their other medications, and that's building up, that scarring building up, those cells are building up, they're releasing that chemical, and then something could happen, and then you're at the point where you need that. Talk to us about the dangers. If somebody overuses albuterol, what are some of the complications that can come from an overuse of albuterol?
Well, albuterol is what we call an alpha drug. That means that it stimulates, a beta drug. It stimulates opening up the airway without affecting the heart. Some of the drugs out in the market, like Primatene Mist, anybody got Primatene Mist in your hand, may as well have a shotgun right at your head, because it's an alpha beta drug. So the more you use it for the lung, the more it stimulates the heart. So cardiac arrhythmias are possible. Less likely with albuterol, but still possible. The other thing is if you keep using it over and over again, then it ceases to work. And when it ceases to work, then you really are in trouble. So if you're using albuterol over and over again, there's a term called tachyphylaxis, where you stop responding to the medication. And once you start responding to it in an attack, then you're in trouble. Let me give you a statistic. Every year in this country, 10 people die from asthma. An African-American child is 3 times more likely to die. African-American women have the highest death rates from asthma because they are not prepared. Mild, moderate, and severe asthma, have the same mortality rates. That means that the people that I've lost with asthma were not those sick people, because if they got real bad asthma, they can get your office when you open. They have the emergency room every minute. They know what drugs to use. They know what they do and don't have, and they tend to be prepared because they've had that experience. The person we have the most difficult with is an athlete who only wheezes when he runs, or he wheezes when he's carrying the football or making those shots. And then he gets into trouble and he starts to wheeze and he doesn't have any medicine or any action plan. And I've lost 3 or 4 teenagers to asthma because of that. So the two things, one is the arrhythmias that are associated with it. And the other is that if you're not prepared, with medicines like that and know how to use them, then
Right.
you like to be one of those people, one of those 10.
So there's 2 other questions I want to ask, and we're going to move into COPD. But the first question is really, are there some things that people can do outside of medication and making sure that they're following, they're adherent with their medication regimen outside of albuterol, which is a rescue med, but there are other medications. Are there anything else that they can be doing? Should they get more HEPA filters in their home? Should they go to an allergist and make sure that they don't have any food allergies that they don't know about? Should they know all of their allergies? Is there something that people could be doing on their own to kind of reduce the potential of having an asthma attack?
Yeah, I think that here again, I say that anybody who's in the emergency room often or hospitalized often nowadays is not paying attention, because we've only talked about the first and second level of treatment for asthma. There are 3 and 4 other levels of things that people can do. Let me just digress and say what those might be. So now we have what we call biologics. These are special medicines that are designed to deal with special chemicals within the lung. Drugs like Xolair, drugs like Dupixent. There are a number of the Nucala. You've seen them advertised on TV. These are revolutionary drugs for a certain type of asthma. Then there's some people who can go and have what you call a thermoplasty, which is an operation for asthma on the lung. And so consequently, I'm only mentioning these because you're probably at level 1 and you're probably sick. You're probably using albuterol as your only drug. I mean, I know because I'm the only one in my office that can refill albuterol. You can be at your grandma's house. You can be anywhere else. I am not going to give you a refill of that medicine unless you go to the ER. I've told you when we started that I'm willing to work with you. I'm willing to help you out. I'm willing to help you develop an action plan. But if you forsake me, I hate to say it like that, but if you start not forgetting the medicines, calling in for an albuterol refill instead of being refilled for the other medicines you should take, I'm not going to do it. I'm not going to let you, suffer. I'm sending you to 4 hours in the ER because I'm just not going to do it. Because my ability to assess your albuterol usage is my best indication as to how well or poorly you're doing. Okay. And so those are the kinds of things. So A, identifying your triggers. We've already talked about that. B, making sure your weight is good, because people who are overweight they're in what we call a hyperinflammatory state anyway. And they tend to have more problems with asthma. So weight and exercise, that's the second thing. Making sure you have the right doctor. I mean, every doctor says I can treat asthma, but you better be sure that the person, if you've got a consistent problem with asthma, taking care of you knows what they're doing. You need to ask somebody. If you don't know, ask somebody about the doctors that you have. And if they don't have the expertise and you like them, as most people do, ask them to send you to a specialist, either a pulmonologist or an allergist. Who you pick to take care of you or your children with asthma has a lot to do with your outcomes. And then when you go in there, you try to understand everything that you're talking about. Don't let them give you that little 15-minute thing, and wave you out because this is not your time. Right. Then you need to understand what they think about your asthma, why they think that. You need to know how they propose to treat it. You need to know what medicines they're going to use and why. And you need to know how they're going to lower those medicines. And then you need to know how to get in touch with them if there's a problem. If you've got a doctor you've got to call 5 or 6 times, then and you've got a child with asthma or you've got asthma yourself, and you need to get some information that might help you from slipping into darkness, you need to know how can I reach you? That's going to be one of the questions if I'm having a problem. So really much of it has to do with what we talk about at the African American Wellness Project. You got to build your own system with any chronic disease, and that's especially true with asthma. In some states, like New Jersey, you can't go to school without your doctor signing off on your asthma action plan. And so you have to have an asthma action plan. You have to understand what it does and when to do what. And I think if you do that, I'm telling you, it's just so tragic. You will never have to go to the ER. You'll never be admitted to the hospital. I don't care how sick you are.
I like that. So develop an asthma action plan.
Yeah.
That way you're never caught off guard. And a lot of times we hear about that. In particular, we hear about it more with sickle cell patients because, they carry booklets and their treatment is very, very complicated. But if you have asthma, it's very, very similar. If you've got an asthma action plan, then if there's a crisis, you know what to do. You've already laid it out versus and that's why people depend too much on that albuterol because they just grab it. That's their action plan is, if I have an attack, I'll just take a couple of puffs of albuterol.
Well, I'm looking at the literature more often than I used to, the general literature. And almost every chronic condition, African Americans suffer worse. Breast cancer, kidney disease, prostate cancer. And none of it has to do with genetics. Much of it has to do with the care you get, and you not having a plan, and you not making sure that plan incorporates someone that you can trust, and specialists that you can use, and facilities that are good. And so consequently, if you don't have that, then for any chronic disease, that's why African Americans often are so much sicker and die more often from some of these chronic diseases. It's not genetic. It's not genetic. It's the fact that you don't have a plan. The system is going to be against you because you're Black. I mean, there's going to be unconscious bias on the part of doctors. You showed it on BlackDoctor.org. We showed it on the African American Wellness Watch. We showed the doctor who was in the ICU trying to talk to you about the fact that, hey, I'm Black here. I'm a doctor, and I'm not getting any treatment. Well, the only solution to that with asthma is to know your disease, know what you need, what triggers it, know what medications you're on and why, and know how to get in touch with that doctor if something happens.
Well, that is definitely important. So again, if you've got a journal, if you've got a booklet, phones now, we've got these notes functions on these phones that you can just put the note and have all of your information there, and then that information can be shared. So that way, even when you're out and about, you've got to know more about your illness than your doctor, right? Because your doctor, you only see your doctor once every 3 months, once every 6 months, once every 12 months. You might see them more regularly than that if you have a tougher condition. Mm-hmm. However, your doctor's not with you every day. Your doctor is not there when you're having the attack. They get it after the fact, or they get it during the attack. They get the call. So you have to be in the driver's seat of your wellness plan. And so I think developing an asthma action plan is a key takeaway from this particular talk. So last question about asthma, then we're going to switch to COPD, which is a cousin of asthma, as I've been learning, is can asthma be cured? I know a lot of times people want to figure out how to cure something. We all want to cure so we don't want to deal with it anymore. Can asthma be cured?
Well, my answer to that question reminds me of the video I've seen of your little son playing football. And you watch him run through all of those people, you can't cure that. You just hope to contain it. And that's the same thing we're talking about with asthma. You really maybe not going to cure it, but you certainly can control it in almost every single instance. And for us as African Americans, looking at the number of our statistics that we're dealing with, I know that there's not a lot of specialists in our community. I know that we can't always get the medications. But in general, if you carve out your own system of care for your children or for yourselves with asthma, you can reduce your office visits, emergency room visits, and hospitalizations. And so that would be my word on that. But I think that you can't cure it. Like I watched him run through all those people. You done showed me the video 2 times. But you can only hope to contain them. And that's the way it is with asthma.
Well, maybe one day I'll show the video to the audience. So they'll get a frame of reference on what you're talking about. But absolutely, I think that the takeaway is this. any illness, whether it's diabetes, hypertension, asthma, high cholesterol, that what we talked about a couple weeks ago, any of these conditions can be controlled where there's very little that you have to do, but you've got to know what it is, know what the controls are, and make sure that you are making those lifestyle changes every day to where you can kind of get off of medication as much as possible and live a healthier and more fulfilling life, even with the diseases. But you've got to figure out how to control it and do what you need to do. So if you're just joining us, I know we're about halfway through. We're getting those in. If you're just joining us, we're here with Dr. Michael Lenoir, and we are Operation Life Back to Basics, where we take some of those illnesses and those diseases that are really affecting Black Americans, disproportionately affecting Black Americans. Dr. Lenoir talked about 3 times more likely to die as Black people with asthma, disproportionately affecting Black people. What we're trying to do is break them down and give you some tips and hints and talk about the medications to where you can have a better and more fulfilling life. So we're going to shift to another thing, and it's the acronym COPD, and I had to learn this. It stands for chronic obstructive pulmonary disease. A lot of people have this, and from what I've known from the layman's term is that person that's dragging that tank around behind them with the oxygen tank. So what is COPD and how is it related to asthma?
Well, a couple of things. One is COPD is a completely different problem. Like asthma, in asthma, the airway closes down because the muscles close down in response to the chemicals. In COPD, there's a barrier between the oxygen you're taking in and the excretion of carbon dioxide out into the system. So it's almost like somebody put a lining in your lung, and that lining is preventing you from oxygenating the bloodstream. And so it certainly is a major problem for lots of adults. African Americans have a disproportionate incidence of COPD. There's some conditions in children where they're born with diseases like cystic fibrosis or alpha-1 antitrypsin diseases, where they are born with chronic obstructive lung disease. And also there's instances where aspiration damages the lung, or the COVID virus is kind of a functional chronic obstructive lung disease.
Okay.
The virus gets into the lining of the lung, destroys it, prevents oxygenation, and that's an acute obstructive lung disease. But if it stays long enough, what is the response of the body to inflammation? It's scarring. Right. And so consequently, COPD is a much more dangerous condition in the sense that it's more difficult to manage, although it can be, and it is a disease that in many instances can be avoided because the biggest etiology, the biggest cause of COPD is smoking.
Okay, and that was just my next question, because I was like, when I was doing my research for this particular program, everything was pointing to smoking. So how is smoking? Is it because, and I know we were talking about that earlier, and I thank the audience member for putting the ends. How does smoking really impact the lung so much that it gets you to developing COPD?
Well, first of all, there's a lot of chemicals that are not kind to the lung. And just the whole ingestion of those chemicals causes destruction of the lining of the lung. And as the lining of the lung is destroyed, it's replaced with fibrous tissue. And that's a simplified way, but that's exactly what happens. And so that most of the COPD in adults is from smoking. And so that's one of the reasons that we're concerned so much about vaping in teenagers, because they're vaping, which also leads to damage of the lung, but also leads to smoking. And so consequently, that's why there have been such a response to the knowledge that the smoking companies for many years targeted the African American community, tailored their products every time they were attacked to be more attractive, and made the cigarette smoking in our community disproportionately effective in causing disease.
Wow. Okay. So, I mean, that's an excellent point. We're talking about vaping, we're talking about smoking. That can be, but if you stop smoking, if you stop vaping, can the body basically heal thyself, as the saying goes?
I just saw an article a couple of months ago that said that if you stop smoking today, you'll live 2 years longer than someone who doesn't stop at the same age, the same level. And generally, if you stop smoking, it takes about 10 years before you have the same risk factors as people who don't smoke.
Okay. So that is the short answer is yes, it can be reversed. Your body can heal itself. However, you cannot continue to do the same things. It's like I always liken it to driving a car. If you drive a car hard and fast all the time, you drive it hard and fast, it breaks down, right? You take it to the mechanic fix it, which is your doctor, puts together a treatment plan, and then you get your car back and you start driving it hard and fast again. It's going to be back at the mechanic quicker. That's the same way we do with our bodies. So if we have our bodies and we're putting things in it, like we're smoking or putting a lot of carcinogens or different, foods that have a lot of fats or anything into our bodies, and we go to the doctor, we have something, a heart attack, stroke, something that happens as a result, diabetes develops as a result. We cannot continue to eat and behave in the same way we did before. Otherwise, we're going to have more complications as a result. So just think about it like that. When we're talking about healthy. Now, does it have to be dramatic changes? And does exercise help asthma or COPD? And I know people talk about exercise in terms of developing their lung capacity, helping their lungs, be able to get more oxygen in, things like that. If I had asthma or if I have COPD and I'm on this path to recovery, will exercise help in that recovery process?
Yes, I mean, there are certainly breathing exercises, lung exercises, just exercise in general will help anybody who has COPD. The problem is sometimes people are so sick that they can't exercise and they can't do things, and that's why it becomes, you have to really start very early on, trying to understand the fact that everything you put in your body has some impact. And certainly if you're breathing into the lung, smoking into the lung, then that has more of an impact. And so, yes, breathing exercises may be as good as medication in many instances in people who have chronic obstructive lung disease.
Okay.
But I think the big thing is in our community is that we just have to stop the incidence of smoking. I'm still amazed at how many people do smoke and smoke continuously, even in spite of the fact that they know the dangers. My father smoked Camel cigarettes, 2 packs of cigarettes a day, and it came out, started coming out. And so I asked him, I said, have you read about all the stuff that smoking causes? He said, yeah, he's going to stop reading. That was his response. And I think that's the response of a lot of people until more recently when smoking has become kind of a pariah in our society. It's a good thing, and I'm certainly hoping being non-vaccinated to a COVID virus attaches itself to the same phenomenon.
Well, it's interesting. You talk about inflammation is kind of the buzzword, right? That's the dirty word. Any type of inflammation, it can be dangerous and detrimental to the body, especially long-term inflammation, because over time that can damage your blood vessels. It can do all kind of havoc inside the body. So any type of inflammation is bad. So this thing, we're making it simple. Inflammation is bad. We're trying to reduce inflammation. I learned a couple of weeks ago that that your body produces cholesterol. So I didn't even realize that until we did our cholesterol program a couple weeks ago. It was like your body produces cholesterol. So any cholesterol you eat is on top of your body naturally produces.
Right. There's no question about that. And I think that the tragedy of both of these diseases is that diseases of the lung that can be prevented with a relatively organized way for the individual to approach that. Simply not smoking reduces your chance of getting chronic obstructive lung disease extremely dramatically. There are some environmental issues, and African Americans, have more chronic obstructive lung disease anyway, simply because of where we live and what we live around, and the fact that we live close enough to hydrocarbon producing machines, cars, and factories and things like that. That affects both asthma and it affects COPD.
Okay. So are the treatments for COPD similar to asthma, or are they a different type of treatment for COPD?
Yeah, they're very different mechanism for the development of COPD, and the drugs that are used for for COPD for asthma are often not effective for COPD.
Okay.
But generally, a lot of people have a combination of COPD with asthma superimposed on that. And a
Okay.
lot of people with asthma who have COPD whose only risk factor was asthma. So some of the drugs may be similar, but there usually is a whole different approach in terms of the medications that are used for COPD. Drugs like Spiriva, you've heard the names. These are different kinds of drugs that deal with the body differently and deal with the lung differently in terms of the chemicals that they neutralize and the ways in which they make the airway respond. So it's not exactly the same treatment unless there are combinations of COPD with asthma superimposed.
Okay. So I think we've got a pretty good understanding here as we're winding down here with Dr. Michael Lenore. We've been talking about asthma and COPD as part of our Operation Life Back to Basics. If you want to get more information from Dr. Lenore, you can go to the African American Wellness Project, and that is it just the letters or is it all the way spelled out?
It's aawellnessproject.org. And I have on that site a document that says to you, if you do what I tell you, you will not be in the emergency room. You will not be in the hospital with asthma. It may not be on until tomorrow, but we just finished that article. You read that article, I guarantee you, if you've got chronic asthma or your child has chronic asthma, you're gonna be surprised at how much you should be able to do to reduce the hospitalizations and certainly the emergency room visits.
Absolutely, absolutely. And we also have an asthma. We have actually two asthma channels on BlackDoctor.org. We've got one that's general asthma, and then we've got one that's specifically for asthma in children. You can go there. There is a host of articles and information there as well on BlackDoctor.org. So there are ways, there are tools out there for you. We talked about earlier in this program, sometimes your doctor might not be the best. I saw some of the comments where people were like, well, should I be asking them this, asking them that? Again, move into the driver's seat of your healthcare. You got to move your doctor to the passenger seat. Let them navigate. But you got to be in the driver's seat, and because you got your foot on the gas and you've got your hands on the steering wheel, to use that car metaphor continually going on. You got to drive your own wellness and health and wellness destination. So aawellnessproject.org is on the screen. There's an article there. Read the article. He told you. You read the article, follow the information in the article, it's going to reduce any type of asthma attacks or asthma crisis that you might have. Just follow what he's saying. If you don't have a good specialist. Check on your allergies. I think that was another thing that we said earlier. Find out what you're allergic to if you're allergic to anything, and find out what your triggers are. That was another thing that we talked about. Identify your triggers. Weight, diet, and exercise. Vitally important to helping reduce the attacks and the stress that have on your lungs. Choose the right doctor. We've talked about that. And then number 4, definitely develop an asthma action plan. Choose a medication. Albuterol should not be your number 1 medication. Choose a medication that works best for you, but give that feedback to your doctor. They need that feedback in order to be able to put you on the right medication regimen that is best for you. So make sure, hey, if you're wheezing, make a note. Drop it down. Hey, I was wheezing today, doc. I took my medication in the morning. I was wheezing that day. Or I went to the gym. I'm finding these are the times where I'm wheezing. These are the times that I have most difficulty breathing. Take that information to your doctor because that helps them make a better decision. Am I missing anything, doc?
I think Dr. Dean, I think you got it all.
Well, I'll be going to medical school. Like everybody seems to be nowadays. I'm gonna get my Google MD and
YouTube MD.
And YouTube MD. But I think ultimately, as we're wrapping up here with Dr. Michael Lenore, I think it's important that we recognize again, you drive the car in terms of your health and wellness.
Right.
Asthma is not a death sentence, but it can be if it's not controlled properly. We've already given you some of the statistics. 3 times more likely, Black Americans, I saw another statistic, 40% more likely than non-Hispanic white Americans have asthma. So there is an issue, and there's a chronic issue. Some of it's environmental, and some of it is just behavioral. How are we going to do what we need to do in order to overcome some of these illnesses and close that gap between us and non-Hispanic white Americans. So, Dr. Lenore, this has been a pleasure. I want to say that there hasn't been any questions. People, you nailed it. People are saying thank you so much. Great information. They're tagging their friends. We're going to re-air this tomorrow morning. So just stick around. We're going to re-air this information tomorrow morning. So if you know somebody that needs this information, it will be re-aired tomorrow morning, 10 a.m. Eastern, because we like to get people this information that they can use. Again, what did I say at the top of the program? We have 3 goals with this Operation Life series. Number 1 is we want to get you the information, right? We got to get you the information that you can use to get you to be your own best health advocate. Number 2, we want you to be more adherent. So Dr. Lenore doesn't tell you, hey, I'm not going to write you a prescription for albuterol. You got to go to the emergency room or you got to come see me. I'm not going to do it. So we need you to be more adherent, but you got to be more adherent with that information. And finally, we want you to have the best health and wellness journey that you can have with regards to how you live your life and make it the best health and wellness so you can successfully age, as we talked about last week on Wellness Watch. So, Dr. Lenore, thank you so much for joining us.
My pleasure. And congratulations to Black Doctors for this series. It's really badly needed.
So thank you so much. And we are looking forward to it. So we've got some other shows coming up. We're going to be talking about cancer, prostate cancer, lung cancer, breast cancer, fibroids. We've got some wonderful programs coming up. All of these illnesses and ailments disproportionately affect Black Americans. And so that's what we're here for with Operation Life. So we'll be here every Tuesday, 7 p.m. Eastern, here on BlackDoctor.org. Thank you all for joining us. I see there's some more comments, but before I let you go, to make sure, thank you all so much for joining us. Yes, turmeric is a great anti-inflammatory. You could take that. It is. So look for your anti-inflammatories. It also helps with hypertension. So find your natural anti-inflammatories, add those to your diet to help reduce some of that inflammation that is the dirty word. So again, thank you all for joining us, and we will see you next time.